Hi, so I'm going to talk to you about tongue tie today. So my name is Nicola and I am trained to be a lactation consultant. I'm a newly qualified health visitor and I'm a breastfeeding mum of 3. So what is a tongue tie? Well, a tongue tie is a restricted tongue movement. So that's the key word there, restricted. A normal tongue should be able to protrude over the gum ridge. It should be able to cup and hold a suction. It should be able to do a peristaltic motion like this, which makes the milk transfer to the back of the mouth, and it should be able to go from side to side, which we call lateralization. So there's 2 types of tongue ties often described, an anterior, which is at the front, and a posterior, which is at the back. Now the anterior generally gives that classic heart-shaped notched tongue that everyone kind of knows and looks for with a tongue tie. A posterior tie is not as obvious and can only sometimes be felt, not seen. But equally, in the research, it's a bit of a controversial topic because some research suggests that posterior ties exist and they can benefit from being cut. Others suggest that actually what that is normal tongue structure. So the signs that your baby may have a tongue tie are that they can't maintain a suction at the breast. They might not be able to latch onto the breast at all. They may have colic and reflux symptoms, and this is because the air is getting in from that lack of suction. They may make a clicking sound, like a this is the suction losing throughout the feed. You might have misshapen nipples, you might have damage, pain, you might become engorged, you might have mastitis. You may also have a low milk supply, or you might have an abundant milk supply because your baby's feeding so frequently because they're not managing to feed effectively. What can you do about a tongue tie? Well, the first thing that you should do is seek some support. That's face-to-face support from your local infant feeding team, a local IBCLC, health visitor midwife. Get to a peer support group if you can, get some support around you, reach out to online services, La Lecture, Breastfeeding Network, Breastfeeding Lactation Support, Facebook page. There are lots of really good groups out there that can help to support you. The next thing that you need to do is really nail that position and attachment. Now you might think that's really difficult because my baby can't latch on properly, but what we need to do is get them to latch the best that they can. Now, one of the best ways to get a baby to latch when they are tongue-tied or you're having any sort of nipple pain or trauma is to try a laid-back feeding position. In a laid-back feeding position, what you're going to do is you're going to take yourself onto a semi-recline. So this could be on a chair just like I am now. You could be on your sofa with your feet up. You could be on your bed. Whatever's comfortable to you, whatever's available to you. And you want your baby in this position where they are in contact with your entire body. Now they will be able to find your breasts instinctively, or you can help them along the way. If your breasts flop to the side, which let's face it, many people do, you can use pillows to help prop them up into a better position. Just do whatever's comfortable for you to get your baby into an optimal position. Now, why this position is so good is because when you are laid back, your baby is on top of you, their primitive sucking reflexes come into effect. So they will naturally want to head bop and get onto that breast. The other thing that helps is gravity. Because they are on top of you, they aren't able to slip off like they may do when they are in a more cross cradle or cradle hold. They are going to be here. It's harder for them to slip away. So that helps them to maintain that latch. It also helps them to get a deeper latch because they're going on top and taking in that really big mouthful of breast. Now, the second thing that might happen is because some babies with tongue tie actually lose quite a lot of weight, you might have to do some breast compressions throughout a feed. This is just to make sure that you're getting optimal milk transfer whilst they are on the breast. Equally, because they might be losing weight and because it might be impacting your milk supply, you may have to express milk in between feeds. This is just to make sure that you have got a good supply for when they are able to latch properly. Now, you do need a really good assessment from someone. If someone comes to assess your baby for a tongue tie and they just take one look at their mouth and go, no, they don't have a tongue tie, then please seek a second opinion. A breastfeeding examination should be from start to finish. So they should watch your baby latch onto your breast. They should watch your baby feeding to make sure that they're doing those active feeding, that suck swallow pattern. And they should then see your breast at the end of the feed to look for any discoloration or misshapen nipples. As part of that breastfeeding exam, the provider should place a clean gloved finger inside your baby's mouth with your consent. This allows them to understand what is happening inside the mouth and make sure that that tongue restriction is not present. Not all babies who have a tongue tie need a revision, and the research suggests that some babies with optimal position and attachment can go on to feed effectively. However, the research does also suggest that sometimes a revision is required, and this helps to reduce maternal pain. Let us know in the comments if you've got any experiences with tongue tie, whether your baby's been diagnosed or whether you've maybe suspected, and also tag anyone who you think might benefit from watching this video in the comments.